on the Medical Watch this afternoon. There's a surge in suicides in the suburbs.
Dina Bair is here with more on the spike in DuPage County and why community leaders are speaking out about this very troubling subject. Dina.
Pat and Lourdes, the increase was noted in the first 6 months of the year during the shelter-at-home order. And now the coroner in that community has issued a public plea.
This is the letter released by DuPage County Coroner Dr. Richard Jorgensen. Compared to the same time period in 2019 when there were 44 deaths by suicide, this year 54 on record between January 1st and June 30th of 2020.
We can go over and visit our friends, our families. We can wear masks. We can call them. This lack of socialization, no question about it, has really hurt our society.
Taking a closer look, 20 of the deaths occurred before the COVID-19 lockdown. 34 came after. The ages of the deceased range from 19 and younger all the way to 80+ years old. The majority were white males. There may be warning signs.
That person is very upbeat all the time, and that kind of starts to change. Sleeping patterns start to change. Something someone was really interested in, they no longer want to do. I've seen people who they started giving away possessions.
Dr. Jorgensen says specific groups are at higher risk. In his investigation, he found common threads among those who died by suicide. A previous history of depression or mental health issues, financial, marital, or personal problems, living alone, struggling with present addictions, previous addictions, but were sober.
Those factors were present in literally every single case.
Accidental overdoses are up as well. In 2019, there were 95 overdose deaths in the county. Dr. Jorgensen says there have already been 70 in the first 6 months of this year.
I think this isn't something that's passing. This isn't something that is in the past. I think it's something we need to worry about more and more as the days get shorter and the nights get colder, and we need to reach out to our family and friends.
We have several resources on our webpage. Use them if you or someone you love is in need, including the National Suicide Prevention Lifeline. You can see the number on your screen right now. And the National Alliance on Mental Illness tells us they've had an uptick in calls during the pandemic. And what that means is people really are reaching out. And that's the only way to get help and maybe change these numbers.
It's so good that they talk about it and that you're talking about it as well, because it raises awareness for so many people.
And there's no shame in it. Reach out.
Very true. Okay, Dina Bair, thank you.